If you want to go shoot your kid up with 50 things, go for it. Have a field day. But it doesn't work unless you do it too. What? Then why are you doing it? You weird freakos?
Culturally, operationally, scientifically, they've lost their mission. They propagate dogma. They pushed cloth masks on toddlers for 3 years.
What is going on with our health? That's what our agencies should be doing to give us real answers, not feeding us fake food pyramids and lecturing us about buying pharmaceuticals and shoving them into your kids no matter what. Rand Paul goes after the fired CDC freak shows, saying there is no medical reason in response to this guy who just got obliterated out of the CDC, rightfully so. I don't even know what took so long. But he's responding to him. He's saying, you know what? There is no medical reason from Rand Paul, a doctor, to give newborns the Hep B vaccine if the mother is not infected. All mothers who deliver in a hospital are tested. This scientist's so-called, quotes, fetish for vaccines is not supported by the data. Rand Paul's a doctor, and this is not medical advice, consult your doctor, but we like Rand and trust him. Chief Nerd is also sharing this. Okay, this is the clip of this fella, and if you remember, sorry to do this, but it's true, this guy was in the government. Here it was posted from Will Kane. This fella says pentagrams, harnesses, the belief that men can get pregnant. This guy's gone from the CDC. Yeah, we think medicine's a little bit better off today than it has been, and now he's gone. But now he puts on a suit and he's like, no, like I'm a real sophisticated person here and I want to talk about jabs.
I mean, from my vantage point as a doctor who's taken the Hippocratic Oath, I only see harm coming. I may be wrong, but based on what I'm seeing, based on what I've heard with the new members of the Advisory Committee for Immunization Practices, or ACIP, they're really moving in an ideologic direction where they want to see the undoing of vaccination. They do want to see the undoing of mRNA vaccination. They have a very specific target on COVID, but I do fear that they have other things that they are going to be working on. Hepatitis B vaccine is on the agenda for the meeting in September. I predict that what they're going to do is try to change the birth dose of hepatitis B vaccine so that kids don't get it when they're born. So if you have a mother who is well connected to care, you know her hepatitis B status, that may not matter very much. But if you have a mother who's not gone to prenatal care, who comes in to deliver, we have one bite at that apple so that child gets that important hepatitis B vaccine.
And they want, man, as soon as that baby comes out, like, put it in there, vitamin K, whatever. Here, you need it. Yeah. Shove stuff into your newborn. Rand Paul says, that's not scientists' analysis. This is a fetish for vaccines. And we know he's already got other fetishes. But Trump is out also asking questions about this. And this was a curious update from the president himself because Trump had been a big proponent of Operation Warp Speed, as we recall. Now, I don't recall Trump saying that you had to mandate it, shove it into your body, or else you're going to die a winter of misery and death like the Biden administration did. And if you want to develop a program and see if it works, kind of like the nuclear bomb program, the Manhattan Project, right? Like, really have the government do something. I'm for the government trying things, but I'm not for the government censoring us, lying to us, telling us that they're the scientists, and then lecturing everybody, mandating, suppressing information, alternative theories, clamping down on drugs, stopping people from tinkering and figuring out their own solutions. It was all a disaster. And now we want a reflection on this. And one of our biggest concerns has been that we just move past COVID without any repercussions at all. Fauci gets a pardon and there's like, that's the end of the whole story? Are you kidding? Trump says, let's look into it. He writes, it is very important that the drug companies justify the success of their various COVID drugs. Many people think they are a miracle that save millions of lives. Others disagree. With CDC being ripped apart over this question, I want the answer and I want it now. I have been shown information from Pfizer and others. It is extraordinary, but they never seem to show those results to the public. Why not? They go off to the next hunt and let everyone rip themselves apart, including Bobby Kennedy Jr. and the CDC, trying to figure out the success or failure of the drug companies in their COVID work. They show me great numbers and results, but they don't seem to be showing them to many others. I want to show them now to the CDC and the public and clear up this mess one way or the other. I hope Operation Warp Speed was brilliant, quote, as many say it was. If not, we all want to know about it and why. Thank you for your attention to this very important matter, President Trump. And that's what we want to. And of course, I've experienced both sides of this debate. I remember back during COVID, I talked to a doctor who was processing COVID deaths. And he told me, he's like, after the jabs came out, COVID deaths went down, right? Is what he said. So his position is they saved lives, but maybe those were the lives of people who really needed it, right? They were the high risk category and it's a subset of the population. And you don't need to give that to every single healthy person, including children and mandate it or else. Okay, so there's, I think, multiple ways to splice this, but we want the truth. We want to know what the answer is because a lot of people are noticing some very serious complexities to it. And a lot of people who are helping people, doctors and businesses are popping up to help people detoxify themselves from all the damage they did from the injections. So we're happy to see some answers on this. And we want repercussions on this, man, because this was the, domestic 9/11 apparatus restructuring of the entire American government to oppose the American people in many, many ways. And so there needs to be accountability for it, just like everything else. And here is more. So we got that guy. He was doing his little talk. Don't need to listen to him again. And of course, there's more reaction to this guy. So he is freaked out that parents might have a say in whether they jab their kids or not. He posted this over from this week. This fella, he is a former Obama era CDC director. Okay, this guy, Dr. Besser. And the quote in this, I think with this secretary, RFK, we're on a path to vaccines being largely parental choice. And that's a major step backwards for public health because they want the doctors who are much better and smarter than the parents to decide what to do. Put this in your body, learn about this stuff, chop your genitals off, whatever.
For 4 years, they wanted to make sure someone was in that seat in the event there was a public health emergency. And there was. There was the H1N1 swine flu pandemic. We now have as an acting director someone with absolutely no public health experience, and that puts us all at incredible risk.
And Dr. Besser, I want to ask you one thing about mandates. It's one of the things that Secretary Kennedy said this week and touted progress that he's made. He said he ended the mandates. Why do you think mandates are important?
Because people are idiots and I'm smarter than you.
Well, when I think about mandates, I think about children going to school. I think about young parents who are sending their children to school and want to know that their children are safe. And the way children are safe from vaccine preventable diseases is by getting vaccinated themselves, but no vaccine is 100%. And so you count on the other children in that classroom being vaccinated.
So it's all or nothing, right? If you want to go shoot your kid up with 50 things, go for it. Have a field day. But it doesn't work unless you do it too. What? Then why are you doing it? You weird freakos?
I think with this secretary, we are on a path to it being largely parental choice. And that is going to put at risk those people for whom the vaccine didn't work and children who may have medical conditions where they can't get vaccinated.
Yeah, terrible. And other kids can't get it, right? So then they can't get the vaccine. So everybody else has to get it. You don't make special accommodations for that one child. And maybe that child goes to special schooling or gets tutored or something like that and has a special unique condition. But no, instead, everybody in the whole population has to go buy this pharmaceutical drug and shove it into their bodies without any real rhyme or reason if they don't need it or anything, because they just say it's good enough, trust the science, and you have no say in what you put into your kids' bodies, okay? It's just a mandate, so just take it because the government's in charge. These people are maniacs, man. It's demonic. Don't you even think about mandating something for our children, okay? We're tired of that. So that is now changing. And here is another one from Callie Means. You know who he is. He says, this is really bizarre stuff, okay? Orwellian propaganda garbage. The New York Times posted this story. Will the CDC survive? Yeah, okay. And honestly, it's like, I'm sure there is some good work that's done there, but I think largely they are another government bureaucracy that says they are doing something meaningful that they're really not. Okay, a bunch of other private entities and other solutions could exist for whatever the CDC does. And the way we know this is because we just had the Super Bowl for the CDC, okay? We had the Super Bowl in 2020. They needed to show up and play and put it all out there, leave it on the field. They didn't do that at all. It was pathetic. It looked like a circus freak show out there on the field. All these CDC morons running around, bopping into each other, bringing golf clubs and stuff onto the football field. What are you guys doing, idiots? And it was a disaster. And now they want to turn around and say, but we're a credible agency and you should trust us now and we need more government funding and all the things. I mean, I think in a sane country, you just say, okay, that was horrible. Like, we're not playing with this. Like, you're just gone. Whole CDC is gone. We need a new entity. Come in here because they promised us like a military level response. First world response to all of this. And they couldn't even friggin' print out masks that didn't work and couldn't get hand sanitizer or toilet paper for people's butts all across America. So he says, give me a break, okay? This is Orwellian, Soviet level propaganda. He says it's truly bizarro world stuff. President Trump and RFK are quite literally fighting demonic forces to return the CDC to the real science. The media is holding up Dr. Pentagram at the paradigm of science, as the paradigm of science. This man is a proud Satanist who evangelizes a bondage age fetish that think it's antiquated to use the word mother and argues every 6-month-year-old should be forced by the government to receive a COVID jab. I'm not trying to be inflammatory. This is a simple factual recitation of the qualifications for the media's lead scientific expert today. And they bring him around on the cable. They're like, well, should we bring the pentagram guy back on? Like, yeah, definitely. He's our dude. So Dr. Pentagram is the type of anti-scientific radical who has destroyed the reputation of the CDC, and President Trump was overwhelmingly elected to get out. President Trump and RFK are fighting for science. The media will not be able to find one NIH researcher or academic in America who could say this administration is pressuring them for scientific findings, as the previous administrations did. In fact, if the media is honest, they would report that there is a groundswell of academic freedom happening in America. While previous CDC officials pressured staff to not release data that contradicts the preferred narrative, we will not see transparency, even if it is messy. That is returning the CDC to science, not attacking it. And I think maybe we will see transparency, even if it is messy. I know there are many employees at the CDC who agree with the agenda to restore science, and this administration will win. From Callie Means working over there with the Trump administration, as we know. Now, Maxine Waters was also out. She's going nuts, being extra Maxine today. Here's what she was screaming about over on the cables.
It is time to call for Article 25 of the Constitution of the United States of America to determine his unfitness, to determine that something's wrong with this president. And I would suggest that we move very aggressively to talk about the danger to this country and to our democracy.
So Article 25, is that new? I don't think I saw that in there. Article 25, that's a new one for us, but all right. Now, we also see here is this fella. He is another doctor, Dr. Marty Makary. He's ripping all these people. He says they just made up everything, okay? They made up 6 feet, they made up 2 weeks, they made it up, and now they're lecturing all of us about science.
The woke world has exploded. I mean,
that with 20,000 employees could not generate a website to track the COVID virus. It was eventually created by one Johns Hopkins grad student. He created a COVID website that the world used. And it's not just 1 or 2 mishaps at the CDC. Culturally, operationally, scientifically, they've lost their mission. They propagate dogma. They pushed cloth masks on toddlers for 3 years. They insisted schools shut out children for nearly 2 years using a phony pseudoscience document that the teachers union edited, and those edits appeared in the final document. They made up 6 feet. They pushed vaccine boosters in young, healthy people. So the CDC needs a realignment, and it needs an extremely strong leader.
Well, the other thing they did, and you and I were talking about it at the time during the height of the pandemic, they seemed to be cooking the statistics. I mean, making it appear as though there were no ill effects of the vaccine, that it was a 100% successful vaccine, 100% effective. And of course, you mentioned the children. I mean, the fact that the adverse consequences of children taking the vaccine were higher than the possibility of serious illness among those same children.
Yeah, David, it became extremely partisan in the last administration. In the Biden administration, the ACIP committee and the CDC fired Martin Kulldorff, who was a leading Harvard epidemiologist and vaccine expert. And that was the sort of scientific intolerance that has marked the culture of the CDC in the last 4 years. And that's why public trust is low. They ignored natural immunity. They came up with their own sham studies and published it in their own medical journal that had no peer review. So it's time to rebuild public trust. And the way we do that as healthcare leaders is to show some humility and to invite a civil discourse. And that's what we're seeing right now as part of the new leadership strategy in this administration.
Man, nice little trip down memory lane there from that fella and all the horrific things that they did to us. And remember, Joe Biden came out and gave us that Gates of Hell speech. This is going to be a winter of misery and death unless you go buy these pharmaceutical companies. Dr. Simone Gold, who's been on this story for a long time, shared this message over from this fella too. Florida Surgeon General, Dr. Joseph Ladapo. He's saying the CDC is like a bunch of scientific cultists.
So I think it was yesterday, there was this rally, if you will, with a bunch of CDC employees leaving their office and going to support these leaders that have resigned. And, I listened to what they had to say. And, this cultish relationship with vaccines, and this leadership is just unable to object.
Yeah, they can't understand that CDC should be about science. And so appreciate that guy. We also have this guy from Stephen Miller. Here's what Stephen Miller had to say about this. Defending RFK, defending the changes at the CDC from the lawn of the White House.
Okay, so how confident is the White House that you can permanently nominate a CDC director that sort of balances the vaccine stance of Kennedy with someone that could pass the Senate?
As we know, the CDC's credibility was shattered during the COVID era. This is now widely understood and widely acknowledged. And CDC used to be, of course, seen widely around the world as a premier health agency. And much of the world discovered in the last few years that CDC was actually staffed by a lot of very partisan, very political bureaucrats who weren't at all concerned about public health and weren't actually very knowledgeable about public health. And we are working hard. And more importantly, Secretary Kennedy, one of the world's foremost voices, advocates, and experts on public health, is working hard to restore the credibility and the integrity of CDC as a scientific organization committed to the scientific method and getting to the root causes of the public health epidemic in this country. There's one chronic illness after another where we have seen incidences and rates in the Western world in general, in America in particular, skyrocket over recent decades and years, both childhood illnesses and adult illnesses. And we know that the drivers of these chronic illnesses are things that can be explained both through environmental factors, both through pharmacological factors, as well as other things that impact public health and well-being. There has been no serious effort until Secretary Kennedy came along to deal with these systemic root drivers of chronic health. And it's an honor to be able to work with Secretary Kennedy as he tackles these issues on behalf of President Trump.
It's really amazing that we're even having those conversations. And I've shared with you before, but I watched Kennedy speak at an event, and he talked about how this all traces back to like 1989. You can see major problems with health all start to spike in the charts. Asthma, diabetes, insulin resistance, all the things, right? All of it just shoots up. And they're trying to figure out why that is. Like there's something causal happening. What is it? Nobody's cared because they probably know what it is, right? It's our food is turning into slop. Inflation, it doesn't just hit your dollar, it hits everything else. Stuff that used to have whole wheats in it has crap, whatever, filler garbage in it. And, gums and fillers and all sorts of stuff. And we got pesticides. Who knows what all the electronic interference is doing? Like there's a lot of different things that could be going on. Not to mention the hyper prescribing of drugs and medication to everybody, right? This is all sort of took up with drug advertising and all sorts of things. So what is going on with our health? That's what our agencies should be doing to give us real answers, not feeding us fake food pyramids and lecturing us about buying pharmaceuticals and shoving them into your kids no matter what. We're happy to see RFK and the CDC getting some serious reform, and even President Trump throwing his weight behind it, saying, I want answers on this COVID stuff. We'll see what we get.